So, good afternoon, everybody. On behalf of the AOGD, the Association of Obstetricians and Gynecologists of Delhi, I welcome all the registered delegates, the participants, our chairpersons, and the esteemed judges of this e-slogan competition. It gives me immense pleasure to be the co-chairperson of this gala event, or the first of its kind virtual, and the 42nd annual conference of AOGD. And I feel honored and privileged to be the co-convener, the convener of one of the opening events of the day, which is this e-slogan competition. I welcome the chairpersons of the day, Dr. Mala Srivastava.
Mr. Sumit, you have to enable my slide sharing, please.
Dr. Mala Srivastava is the president, AOGD, a senior consultant, gynecologist obstetrician of the Institute of Obs and Gynae at Sir Gangaram Hospital, and an expert robotic surgeon. Welcome, Dr. Mala. And the next chairperson of the day is Dr. Mamta Dagar. Dr. Mamta Dagar is a senior consultant professor, GRIPMA, at the Institute of Obs and Gynae, Sir Gangaram Hospital. So I would request Dr. Mala to say a few words before we start with the proceedings.
Thanks, Dr. Kanika. Good afternoon, everyone. On behalf of the organizing committee, it's my privilege to welcome you all to this 42nd annual conference of AOGD and first e-conference of AOGD. During this corona pandemics, we have evolved and continued our academic activities through e-platform. I'm happy that our chairpersons of the slogan committee, Dr. Kanika Jain, Dr. Mamta Dagar, Dr. Niti Tiwari, has planned and crafted this slogan competition in a well-organized manner under the guidance of Dr. Geeta Mendiratta and Dr. Chandra Mansukhani, who are the scientific committee chairpersons. It's my pleasure also to welcome Dr. Josna, who is our most esteemed judge for this session. Today is the first day of a vast e-conclave spread over 14 days. We thought we must start with the academic program with PG activities so that our PGs and our residents are free before the conference to enjoy the academics. So all the PG activities like this slogan competition, free paper competition, poster competition will be over before the actual workshop begin and the annual conference begin. So now all our PGs and young delegates are free to concentrate on the various academic activities of the conference. I wish best of luck to all the participants, and I hope you all will enjoy the festivities that are lined up for you over these days. I hand over the platform to Dr. Kanika for the day's proceedings. Over to you, Dr. Kanika. You can carry on now.
Very nice of you to say those few kind words. I would request Dr. Niti Tiwari. Dr. Niti is a senior consultant in the Department of IVF in the Institute of Obs and Gynae at Sir Gangaram Hospital. She is the co-convener with me for this e-slogan competition and has been a real right-hand assistant with me. And it was a pleasure working with her. So over to you, Dr. Niti, to please introduce the judges and proceed for the day.
Good afternoon, everyone. It is time for the AOGDians to show their creativity and social awareness. So welcome you all for the e-slogan competition. I would like to introduce our esteemed judges for the competition. Dr. Geeta Mendiratta, who is a senior consultant in the Department of Obstetrics and Gynecology, Sir Gangaram Hospital. Dr. Kanika Jain, who is senior consultant, gynae endoscopic and robotic surgeon in Sir Gangaram Hospital, New Delhi. Dr. Jyotsna, who is a senior consultant obstetrics and gynecology from Jahangir and Jupiter Hospital, Pune. She has joined us from there. Thank you, Dr. Jyotsna. And Dr. Kalpana Mehta, who is a senior professor, Department of Obstetrics and Gynecology, SN Medical College, Jodhpur. Welcome, Dr. Kalpana, to Delhi conference. And with this, now we will start with the e-slogan competition. Please note that the participants will be invited in the serial number in alphabetical order to display their PPT and speak out their slogan. Suppose any participant misses the opportunity or because of some technical error, we will give the opportunity in the end. It will be followed by questions from the judges, 2 to 3 minutes per candidate for showing the PPT, speaking it out, and the question answer. Marks will be given on the following parameters. Please note: the presentation, language, originality and content, relevance to the theme, and answers to the questions asked. Only one entry per candidate will be allowed. We have already made it clear, and the decision of the judges will be final. So best of luck to all the candidates. And with this, I invite the first participant today, who is Dr. Anita Rajoria. Dr. Anita, would you please share your screen and speak out your slogan?
Good afternoon, everybody. My regards to all the judges and organizers. Hope you are able to see my screen.
No, we are not.
Please allow me to share my screen.
You have the right, madam.
Yeah. Now you can, Can you see it now?
Yes, we can see the screen.
Okay. So मेरी तरफ से सबको नवरात्रि की भी शुभकामनाएं। आप मुझे हरे रंग में देख रहे होगे। आज का रंग हरा है और मैं ये बताना चाहती हूँ कि जो हमें टॉपिक दिया है वो बहुत ही सटीक है, कोविड और मदर में इन्फेक्शन। तो मेरा जो स्लोगन है वो है, न हो नारी स्वास्थ्य पर कोरोना संक्रमण का प्रहार, है जननी और शिशु का इससे बचने का अधिकार। धन्यवाद सभी कोरोना वॉरियर्स को।
Dr. Anita?
हाँ जी।
Interesting presentation. Would you like to just answer a question?
Yeah.
What you've said is a nice slogan, but it looks like a wish list. How do you suggest implementation of it?
So we all hope and pray that corona does not attack female health in any way. So we have taken many steps to prevent our pregnant mothers from COVID attack. Like we have organized their antenatal visits. Whenever they come for antenatal visits, they are restricted, and the antenatal visits, whenever they are coming for antenatal visits, we counsel them about hand hygiene. We counsel them about respiratory hygiene, and they are advised not to be accompanied by many attendants when they come for ANC visits, and a scheduled visit is made so that there is no overcrowding in the OPDs or antenatal clinics also. So, and telemedicine has been really promoted in these COVID times to avoid infection in pregnancy. And routine ANC care can be given over telecommunications also. So that is very important. And all precautions are taken by healthcare workers to protect them also. And all the mothers who are coming and who are suspicious are having COVID tests. We are doing rapid tests in almost all the patients who are getting admitted, even if they are admitted in emergency. Otherwise, near term, we are sending them for RT-PCR also. So that is very important, and we have to protect our personnel also. And we are using personal protective equipment when handling suspicious or COVID positive patients.
Thank you.
I would like to add a little bit. I think MAMS is a very nice tagline for promoting a vaccine, because in the slogan, these things are not covered. So I think we can use it as a tagline for promoting vaccine once it comes. Maybe a pharma company can use it.
Thank you so much, ma'am. Thank you so much.
Now we go on to the second candidate, Dr. Ankita Maan. Dr. Ankita Maan, would you please share your slogan?
To the organizers, Dr. Neeti and Dr. Kanika, please make sure that the answers are within 2 minutes and the people are not given such a long time to go on answering.
Sure, ma'am, sure. Dr. Ankita Man, please. Dr. Ankita? Are you there? Dr. Ankita? So we go on to Dr. Ankita Srivastava. We will take Dr. Ankita Man whenever she is able to join. Dr. Ankita Srivastava, can you share your slogan?
Yes, ma'am. Good afternoon, respected judges and delegates. I am Dr. Ankita Srivastava. It took a pandemic to realize what was important to us: protecting our mothers, who are the true heroes, survival of the fittest, survival of humanity. Thank you.
Dr. Ankita, we can't see your screen. You can't see your screen.
Can you see it now, ma'am?
You can stop
No,
share
we
and start
can't.
again.
No? Is it visible now, ma'am?
No, Ankita. Should we go on to the next candidate till Ankita does the troubleshooting with her, so that we don't waste time? Ankita, should we go on to the
ma'am.
next one?
Yes,
Okay,
ma'am.
then, till then you can do some troubleshooting. Aparajita Gupta.
Yes, ma'am. Dr. Ankit.
Ankita, you have to stop sharing so that Dr. Aparajita can share now.
Stopped, ma'am.
Dr. Aparajita, please. Yeah.
Yes,
Thank
ma'am.
you.
Good afternoon, everyone. I am presenting my slogan. COVID-19 से मचा है हाहाकार, डॉक्टर है परेशान और जनता है बीमार, पर गर्भवती महिलाएं रहे आश्वासित, ओयोजीटी के डॉक्टर्स हैं आपकी सेवा को प्रतिबंध.
Thank you, Dr. Prajita. That was
Yes,
nice.
ma'am.
Just that your pronunciation of Hindi was slightly, I wouldn't say very appropriate. Can you answer one question? Are you not giving a
Yes,
false sense of assurance to all the ladies so that they can get pregnant during the COVID times?
I don't, ma'am, people are getting pregnant and we are not giving false assurance. We are trying, now new avenues are open such as teleconferencing, virtual consultation, so that we are able to provide best antenatal care as possible to the patients. And COVID is here to stay. Many patients who are coming with infertility, we were sending back at the start of the COVID-19. Now we are even giving them treatment for infertility. So that because for COVID, we cannot stop our normal lives now. We have to realize that COVID is here to stay till 2022, as predicted as 2022.
Okay, now we go on to the next candidate, Bhavya Bharadwaj.
Is there any other question from any of the judges?
No, thank you, Kanika. That was very well taken. I think we will just limit to one question because we have to be in interest of time.
Good afternoon. Is my slide visible?
Yes, Bhavya, go ahead.
Okay. Good afternoon, respected judges, the delegates, and my fellow participants. Today, I'll be presenting my slogan based on the theme COVID-19 infection in obstetrics and gynecology. So the slogan goes as, with the enigmatic aspects of the COVID disease yet to unfold, the expecting mothers need to be told, as within them another precious life they hold, before it takes on a further toll. Thank you.
Good, Raini. A question from me would be, are you trying to suggest that the lady should avoid pregnancy?
No, ma'am. Through my slogan, I just want to convey that the mothers who are pregnant mothers, they should be we as clinicians will be doing in every possible way what to assist them, but the mothers themselves should be made aware of so that they can take necessary precautions so that to ensure a good outcome for both the mother and the baby.
Any other question or we move forward?
Thank you. Next, please.
Okay, so we can go back to Dr. Ankita Srivastav. Dr. Ankita, will you be able to share? Otherwise, our backend team can help you.
Dr. Neeti, if we have the time, we can maybe give the contestants some more time in case required. I mean,
yeah, that's okay.
If you have the
Dr.
time.
Ankita, now Dr. Ankita is sharing her screen. She's slogan number 3. Judges, please note, she's slogan number 3. Dr. Ankita, you can go ahead and speak your slogan.
Good afternoon, respected judges and dear delegates. It took a pandemic to realize what was important to us, protecting our mothers who are the true heroes, survival of the fittest, survival of humanity. Thank you.
Thank you, Dr. Ankita. That was really nice. Can you just explain what you mean by survival of the fittest?
Basically, I'm hereby drawing an analogy between our emotional status during COVID pandemic as well as our healthcare status. So if we look at the pandemic in totality, even it affected our psychological status. So psychologically, as well as in the healthcare sector, as well as health-wise, whoever was the strongest was able to survive. People with comorbidities had higher risks. They were at higher risks. They were at home mostly. So these things were affecting them: diabetes, hypertension, all these comorbidities, fitness in terms of their health, in terms of their bodies, as well as in terms of their minds. So it is coming together of mind and body together.
Should we move?
Anybody else? Anybody else wants to ask something?
Okay, so we move ahead now to the contestant number 6, slogan number 6, Dr. Bhavani Shekhar. Dr. Bhavani, please share your slogan and speak. Bhavani, can't hear you. You're not audible. Please unmute yourself. Bhavani, can you share your screen? You need to unmute yourself. No, you're not. You are still muted.
It's unmuted now. Bhavani, please speak up or else we can come back to you later.
Do you have a mic connected to your laptop? Do you have a mic connected to your system? Do you have a mic connected? We can move to the next. We'll give you a call and coordinate. Don't worry.
Yeah.
We'll move to the next.
Bhavani, you can stop sharing and we just do a troubleshoot and then we come back to you again. So we go on to slogan number 7, Dr. Deepa Gupta. Dr. Deepa Gupta, can you please share screen?
Is my screen visible to all?
Yeah, we can see it, Dr. Deepa.
Good afternoon, esteemed judges, Dr. Marla Srivastava ma'am, and all the delegates. The slogan, my slogan is, give our doctors the respect due. They are the ones fighting to protect you. Ours is a very noble profession. And we gynecologists at this pandemic time are doing a lot of great effort. Pregnancy is a very high risk condition and lots of expectations of the society and the family are attached to it. And the lady is very nervous and very anxious. So besides the antenatal management, we have to do a tremendous amount of counseling for that. And we as a gynecologist are at great risk of exposure during the examination, during the labor management and all the surgeries and all. So at this difficult and the challenging time, both the doctors and the patient has to be very understanding and very respectful of each other.
Dr. Deepa, question is to
Okay.
slogan, which is the next slogan you have. So restrict to it. The question for you is, do you know of some recent action taken by the government to protect the doctors?
So, see, lots of things have been taken by the government and all, but the important part is how to implement those things. So I still feel the doctors are really not respected a lot. They have been taken for granted. And I think whatever the government takes for them, it has to be implemented very strictly, and the strict action should be taken for those who are responsible for all these things.
Thank you. Anybody else?
Should we go on to the next one, Dr. Kanika? Hello, Dr. Kanika, should we move on?
Yeah, Nidhi.
Okay, so we go on to the next participant, Dr. Dipali Garg. Slogan number 7. Dr. Dipali Garg.
Good afternoon, everyone. Good afternoon, everyone.
Good afternoon.
You, Dr. Dipali, just please speak out your slogan now.
कोविड से सब रहें सावधान, माँ और शिशु की बचाएं जान, गर्भवती की रक्षा हेतु कितने कोविड वॉरियर्स ने दिए प्राण. By this slogan, I want to convey that it is not only necessary for the pregnant ladies to practice all those necessary precautions for themselves, but they also must realize that as a COVID warriors, doctors, healthcare providers, they're also at risk if they do not take necessary precautions to stay free from COVID.
Thank you, Dr. Dipali. I think I would again request everybody to just stay restricted to the slogan. We can ask the questions and ask them the meaning if we require. So the question for you is, do you really think that the COVID warriors have died treating pregnant women only? I mean, apart from the other specialties, and what is the mortality rate you've seen with the obstetricians dying of COVID, treating their patients?
Ma'am, actually, I do not know the statistics of specifically all the obstetricians who are dying, but as a totality, because this slogan was for obstetrician and gynecologists, that's why I told, but not only the COVID obstetrician are dying, more or less all the healthcare providers, not only the doctors, also the nurses, the other paramedical staffs, they are also at risk if the patient do not take care of these precautions and they get infected more and more.
Thank you. Thank you.
We go on to the next one. Dr. Kajal Sharma, have you joined us? Dr. Kajal, yeah, she's there. Dr. Kajal, you can share your screen.
Good afternoon, everyone. I am Dr. Kajal Sharma from Lady Hardinge Medical College. My slogan for today's competition goes like this: हाथों को धोना, मास्क पहनना, कोविड के लिए ये 2 हथियार, इनको अपनाना भूल ना जाना, स्वस्थ महिलाएं तो स्वस्थ परिवार.
Very nice, Dr. Kajal. And the question for you would be, what are the other things to protect people from COVID? Do you think these are the only things required, or these are the only precautions?
Ma'am, we know preparedness is the essence in COVID prevention. We are, as my slogan goes, we should be dealing with the mass, and these are the changes which we can bring out in the publics and which can cause major differences in the incidence of COVID. And mask and hand washing, social distancing, and maintaining adequate hygiene. Important component of the basic things which can help us to decrease the incidence of COVID on the mass level.
Thank you.
Thank you, ma'am.
Anyone else? We have time.
Ma'am, there are other things which can be done, like if we are educating the female of the family, we are hence educating the entire family, as she is the backbone. She can teach her children, she can teach her parents. She has the capacity to address a larger population. We as the gynecologists have the best population to teach for this purpose, so that we can address the majority for same, ma'am.
Okay. Neeti?
Okay. Thank you, Dr. Kajal. So now we move on to Dr. Kavita Sharma. Dr. Kavita Sharma had made 5 entries and beautiful slogans, but now she has to select one. Dr. Kavita. Dr. Kavita, we can't hear you.
Volume is less. We can hear her. Volume.
Hello. Am I audible?
Yeah, now it's better.
Can you see my screen?
Yeah, we can.
Good afternoon, respected judges and delegates. In the theme of COVID-19 infection in OBS and Gynae, my slogan is wash your hands and sanitize. Don't take any mild symptoms light. Would-be mothers and doctors will win this corona fight. Don't give up hope. The end is in sight. Thank you.
Dr. Kanika. Dr. Kanika?
Yes.
No.
Dr. Kavita, can I ask you a question?
Yes.
That was a very nice slogan and very ended in a positive note also.
Yes.
Can you tell us your personal experience with corona positive mothers in brief?
Yes, I work in a COVID dedicated facilities at GTB hospitals. And from the start of the pandemic, like from the March, we have been seeing patients who are like suffering from COVID, and they have been coming to us. And the most good thing that I felt about that, after like taking deliveries and after doing so much of work, at the end, they are like always going with happy faces, and the husbands are also like very happy that their mothers were treated and their all complaints were listened to, and they were not neglected by us. And in the due time, my colleagues also got corona positive, but all of them recovered. So it was a happy and a mixed kind of experience for us and our all team.
Thank you, Dr. Kavita.
Thank you.
Thank you so much, Dr. Kavita. So
Neeti,
now
let's proceed.
Yeah, we move on to Dr. Mradula Bansal. Dr. Mradula Bansal, can you share your screen?
नहीं कोई जरूरत नहीं, वो रख दो फोन वाला।
Sorry, Neeti, my connection had gone in between.
Yeah.
Back.
Yeah, Dr. Geeta asked the question. Yeah. Dr. Mradula, do you need help? Yes. We can project the slide on your behalf. We have the backup.
Do that if you can.
Mr. Sumit, can you help? Just project the slide of Dr. Mradula Bansal. Yeah, thank you.
No,
मैंने हिंदी में भी लिखा हुआ है एक्चुअली, और इंग्लिश में उन्होंने मांगा था तब इंग्लिश में दिया था।
ठीक है,
मैं हिंदी में बोल रही हूँ। मैं डॉक्टर मृदुला बंसल का सभी को नमस्ते। भीड़ भाड़ के पास न जाना, बिना मास्क के बाहर ना जाना, हाथ धोने से ना कतराना, ऐसे ही माँ बच्चे को कोरोना से है बचाना। हम हेलमेट यूज करते हैं, चोट से बचने के लिए, वैक्सीनेशन लेते हैं बीमारियों से बचने के लिए। तो कोरोना का तो वैक्सीन नहीं है, तो हमारा वैक्सीन क्या है? हमारा वैक्सीन अभी मास्क,
हेलो ठीक है ना,
हमारा वैक्सीन है अभी मास्क, दूरी बनाए रखें, भीड़ में ना जाएं और खुद को और परिवार को स्वस्थ रखें। हम यदि हाथ बार बार धोएं, हम यदि 2020 को जब अलविदा कहें, तब हम कहें कोरोना अलविदा, अलविदा, अलविदा।
That's very nice, Dr. Bansal. A very nice way of presenting. Do you think the people should be wearing a surgical mask or N95 or a simple cloth mask? Which one do you suggest?
In my society, I am normally seeing that they are using 3-layered mask most of the time, and very few they are using N95. What is your recommendation?
The best protection is with N95. And
okay, I am using N95.
Normally people keep wearing a thin cloth mask, which is no protection at all, apart from the pollution ban. Thank you anyway. So Dr. Neeti, go on to the next contestant.
Okay. Now we have slogan number 13, Dr. Poonam Kashyap. Dr. Poonam Kashyap, please share your screen. Dr. Poonam, are you there? She's there, but Dr. Poonam, I think we can
Neeti, move on to the next contestant, please.
So Dr. Purnima Sharma. Dr. Purnima Sharma is slogan number 14. Dr. Purnima, please share your screen. Dr. Purnima.
No.
Good afternoon, respected judges. My slogan is हाथों की सफाई और 2 गज की दूरी, गर्भवती महिलाएं निकलें तभी बाहर जब वो बहुत जरूरी. And the reason is that every woman who takes all these precautions, they are also a COVID warrior, because they are the one who can take the responsibility for the safety of their family as well. Thank you.
Dr. Purnima, do you think only this applies only to pregnant women? They should not go out, or it applies to everybody?
Ma'am, it applies to everybody, but if they are the women are educated, they are the one, they can educate everyone in the family, so they should be sensitized.
Anybody else?
I think let's move on to the next one.
Okay. So next one is Dr. Prerna Tayal. Dr. Prerna Tayal, number 15, slogan number 15.
I'm ready with my slogan.
Yeah, okay, Dr. Prerna.
Good afternoon, everybody. My slogan is, the current COVID times are pretty tough. Pregnancy at this hour may be quite rough, but AOGDs are here to help, because we always put service before self. Thank you, everybody.
Very nice, really nice, Dr. Prerna. Dr. Prerna, would you, just as a, not related to the slogan, would you advise ladies coming to you with infertility to get pregnant during these corona times?
Ma'am, I personally would not prefer the women who are facing infertility to get pregnant, at least for this year, because up till the time a vaccine or a prominent treatment comes up. Because ma'am, we never know what are the repercussions of this COVID on the fetus as such, or are there any GCAs that might be seen in future with these babies. So that would be my opinion, ma'am.
Dr.
So,
Jyotsna, please unmute yourself.
yeah, Dr.
Dr.
Jyotsna
Jyotsna.
wanted to ask something, I guess.
Dr. Jyotsna, unmute yourself. Yeah.
Okay, I was just saying if the AMF value is very low, what is she going to advise? Neeti will know better.
Yeah.
Ma'am, then so we have to, ma'am, we need to give her treatment, because otherwise, if we go on waiting for time till the time vaccine comes, and it might be too late for her to get pregnant. So
And
The
we
rhyming
need
is
to,
very
we need
nice.
to, yes,
none
ma'am.
of
We
the
need to,
societies, you know, the infertility societies, none of the infertility societies or any body, obstetrics body is also, you know, advising against conception during these times.
I still feel if the AMH is low, unless it's very low and very advanced maternal age, we can still put her on OC pills for some time and then start. So I agree with Dr. Prerna. Okay, so the next.
Thank you.
So I just got a message from Dr. Poonam Kashyap that she's ready. Can we take her? Dr. Poonam Kashyap? Dr.
Yeah,
Poonam
please.
Kashyap is slogan number 13. Please, judges, please note. Slogan number 13. Dr. Poonam, you can share.
Good afternoon, esteemed judges. Can you hear me, ma'am?
Yes, yes, we can.
Good afternoon, esteemed judges and delegates. My slogan is Corona
Can you share your screen, Dr. Poonam? Otherwise, we can help you. Can you share your screen, your slogan?
I'm sharing, ma'am.
Okay, we can't see.
Neeti, you share. Neeti, you share.
Yeah, Sumit, please share her slogan. Yeah.
Ma'am, I've written in Hindi also. Actually, I just wanted to share.
Okay.
You can speak it out in Hindi, that's no problem.
Dr. Poonam, you can speak out.
Okay, ma'am. कोरोना के विरुद्ध छेड़ दिया द्वंद्व, मां शिशु की सुरक्षा का हमने लिया प्रण. We have started a fight against coronavirus. R is a dedicated COVID center, so that's why we are getting all over referral from all over the place, and we have already treated around 350 patients of and delivered so many deliveries and also cesareans. So R is a team which is actually fighting against corona, and we hope that we'll be able to do in a very successful way. So that is why we have, I've written that along with the pediatrician and obstetrician, along working as a unit in our hospital, successfully conducted so many deliveries and delivered healthy babies, and also protected so many mothers against coronavirus.
Dr. Poonam, with your vast experience, can you just throw light on this? Would you really recommend a face shield for a newborn?
Ma'am, actually, this was a new concept. Ideally, we are not recommended, but I saw this picture in some Thai project, which they have actually recommended that this can be an additional protection. Otherwise, as of now, we are not recommending facial for the newborn.
Any guidelines on breastfeeding during this time? What precaution would you like to advise the women?
For the women, we actually asked the mother who is a COVID positive to put her a mask.
Some signal issues, I guess.
Feed the baby. Previously, we used to isolate.
Dr. Poonam, there is some connectivity issue. What you can do is you can write your answer. Dr. Poonam, we could not hear your answer because there is connectivity issue. Please write your answer in the chat box so the judges will read it regarding the breastfeeding.
I'm not able to hear you, ma'am.
I'm saying, Dr. Poonam, There is a connectivity. Acha, we will write it in the chat box. We go on to the next contestant. Sonali Barik, Dr. Sonali Barik.
Dr. Shalini
Dr.
Singh.
Shalini Singh, sorry, Dr. Shalini Singh, who is slogan number 16. Dr. Shalini Singh, slogan number 16.
Ma'am. Yes, ma'am. Can you see the screen, ma'am?
Yes, we can.
Good evening, everyone. My slogan
I'm
for
not
the.
able to hear you, ma'am.
Ma'am, can you hear me?
Mute karo.
We can hear you.
Ma'am, I have unmuted myself.
Yes, Shalini.
Yes, ma'am.
We
Ma'am,
can
my
hear you.
yes, ma'am. My slogan is, हमें पता है कि चिंता है भारी सर पर पड़ी, कोविड-19 के समय आ गई आपके प्रसव की घड़ी, रहे निश्चिंत क्योंकि हम हैं आपकी सेवा को तत्पर, आप बस रखना 2 गज दूरी और रहना मास्क पहनकर. Thank you.
Tena, is it the vaccine you're trying to show in these syringes with the arrows?
No, ma'am, it is basically my posted deficits that we are trying to save the pregnant females who are undergoing the process of delivery or are admitted for normal vaginal deliveries, and we are trying to protect them as much as possible.
Okay, thank you. Anybody else? She still has some time.
Dr. Shalini?
Yes, ma'am.
Can you hear me?
Yes, ma'am.
What measures you are going to take to provide respectful maternity?
Respectful maternity. Ma'am, whenever we are, I work in a center, ma'am, where we are dealing with both the COVID suspect and non-suspect women. Ma'am, whenever we are delivering a patient who is not, is a COVID suspect, when we don't have their reports, ma'am, we though we go out in PPE, but still we talk to them properly. We guide them that we give them a glimpse about the future when they deliver a baby, they might not be roomed in, but still as soon as their report comes negative, or they even if they come out to be positive, we give them assurance that they'll be roomed in as soon as possible, and they can still breastfeed the baby even if they come out to be COVID positive, which is the most commonly asked question by the patients to us कि मैम हम पॉजिटिव हो गए अगर तो हम क्या बच्चे को दूध पिला सकते हैं.
That's a nice answer. Dr. Neeti?
Thank you, ma'am.
Then we go on to the next participant, slogan number 17, Dr. Sonali Barik.
Hello, good evening all.
Yeah, Dr. Sonali, good evening. And we need to see your screen.
Yes, ma'am. Yes, ma'am. I'm sharing. Is my screen visible?
Yes, we can see it.
Good evening, all respected chairs and my fellow participants. The theme of the e-slogan was COVID in obstetrics and gynae, and my slogan goes like this: before, during, or postpartum, safety, hygiene, and high-quality care is her right. COVID positive or not, lactation must continue. Childbirth experience should be a delight. Thank you.
I just wanted to know what are these symbols? What are they trying to depict? What are you trying to depict through these symbols?
Yes, ma'am. Can you see my arrow, ma'am?
Yeah, we can see your slide. Yeah, I can see.
Yes, ma'am. Yes, ma'am. Yes. Through this arrow, this is a pregnant woman, which is depicting the antenatal period of that woman. And below that, you can see, ma'am, if we take proper hand hygiene, we properly wash wash and take proper sanitization. And the second thing is showing the social distancing. We should these all come under the safety and hygiene practice. And this is the newborn showing the natal and the postnatal period. And then we can see the mother lactating her baby. And the last symbol is showing a positive childbirth experience, overall positive childbirth experience.
Thank you. Anyone? Dr. Geeta?
I think we carry on. You've asked very relevant questions, Kanika. We are in sync with you. Please carry on.
Okay, so we go on to the slogan number 18, Dr. Swati Agarwal.
Very good afternoon to respected judges, and I'm Dr. Swati, and I'll be presenting my slogan on COVID-19 and pregnancy. Is my screen visible, ma'am?
Yeah, we can see it.
Okay. So my slogan is, कोविड महामारी से थम गई संसार की गति, पर रुक न सकी प्रसव पीड़ा और संतान उत्पत्ति। आओ करें प्रण, थमेंगे न हमारे कदम, बनाएंगे इस कठिन समय में भी गर्भावस्था को सुगम। Thank you.
Excellent, Swati. Considering your vast experience with Lady Harding, you must be dealing with lots of cases here.
Yes,
I would again ask you the same question. Do you think you would recommend a lady coming for infertility at this time, you would encourage her for pregnancy?
Ma'am, the question to this, I think Prerna has answered it quite well, that, still evidence is coming up as to what is the effects of COVID-19 on the fetus. It's still unknown. It is a new, never seen before disease. So till the time it is absolutely necessary, as Dr. Jyotna rightly pointed out, if the AMH is low, patient is very, very keen, she's not ready to wait even for a year, then in that case, maybe they may be allowed. But for, normally we have a population 20 to 23 years old, just after 1 or 2 years of marriage, coming for infertility checkup and all those things. I think that should be discouraged. So that is my take on it now.
Yeah, definitely. And especially the kind of population coming to Lady Harding, they come for second or the third child also with infertility. I think those people should be definitely warned.
Swati, can I ask a question?
Sure, ma'am. Please go ahead. Good afternoon, ma'am.
Hi. Now, you are with a busy hospital, COVID positive hospital. What are your personal fears when you have to, say, deliver a positive patient or do a surgery on a positive patient, because you are standing less than 6 feet for more than 10 minutes, which is the cutoff limit and time for getting a corona. So what are the fears? This is a very personal question I'm asking.
Yes,
what
ma'am.
goes on in your mind?
Ma'am, the most common fear that all of us have is that, the adjustments of our PP equipments, there is a fogging, if our mask is not proper, fogging occurs, and then we are not able to see clearly. And then, when you try to adjust, there may be a break in the PP. So the main fear in our mind is that, they shouldn't, and sometimes some part of your PP just exposes some of your skin. So that is the main fear, that any maladjustment of PP, that is the primary fear. And the second fear is that our surgery or our performance should not get affected by the PP. That is the second fear. One fear is for us and the second fear is for the patient, because it is quite cumbersome to do a surgery in that full PP and standing for a long duration, especially, as consultants, we go in only when there is a complication. So that entails a prolonged surgery. So that is, that my personally are two fears, one for me and one for the patient.
Thank you, Dr. Swati.
Thank you.
We move on to the next participant, Dr. Tasneem Jahan. Dr. Tasneem, slogan number 19.
And 20, whichever she wants to choose.
Yeah, whatever.
Tasneem, I guess is still signal problem lag rahi hai. She's not
Tasneem?
live video.
Yeah, ma'am, I'm sharing with mobile, so it's a bit difficult.
So we can share it for you. Should we share it for you?
Yeah, ma'am. Sure.
Please share her slogan.
Which slogan she wants to project?
Yeah, which slogan do you want? Number 19 or 20?
I
कोई
have
हाथ अगर मिलाए तो okay, this one ठीक है. Okay, Tasneem, you can speak now.
Yeah, 1 second, ma'am. Good afternoon, everyone. I'll be presenting my slogan based on COVID-19, pregnancy in COVID-19. My slogan goes, कोई हाथ अगर मिलाए तो, कोई हाथ अगर मिलाए तो खुद से एक सवाल करना. तेरे अंदर जो पल रही है जिंदगी, तेरे अंदर जो पल रही है जिंदगी, उसकी जिंदगी का ख्याल करना. Stay home, stay safe.
Very nice way of presentation, Tasneem. I would like to ask you, do you think only a handshake can cause corona if we are washing our hands regularly?
No, ma'am. There are many other way of infection of coronavirus, but according to the FOXI guidelines, that is the Federation of Obstetricians and Gynecological Societies of India, the main preventive measure which should be taken is social distancing. So I have focused on that. Other than that, what we can do is stay at home, maintain hand hygiene, respiratory hygiene, and avoid touching the face and maintaining the distance.
Anyone else? Dr. Geeta?
Dr. Tasneem, have you worked with COVID positive cases?
Yeah, ma'am.
So what are the personal fears you faced while dealing with positive patients at a personal level?
Yeah, ma'am. I'll agree with whatever doctor has said before. Like, first of all, we fear that if the PPE is not proper, like we might end up getting infection, COVID-19 infection ourselves, which does happen at times. And the other thing we can say is like during surgery, we might end up risking the life of our patients due to difficulty with the PPE.
Thank you so much, Dr. Tasneem.
Okay, ma'am.
So now we go on to slogan number 21. Slogan number 21, Dr. Vijeta. Dr. Vijeta.
Am I audible, ma'am?
Yeah, you are audible. You can share your screen.
Okay, ma'am. I'm just sharing. My screen is visible.
Yeah, we can see it nicely.
Can I start now, ma'am?
Yeah, speak.
Good afternoon, everyone. With the help of my e-poster, I want to create awareness amongst the pregnant ladies. So I will now present my poster. कोरोना की है ये बीमारी, गर्भ अवस्था में करे उचित तैयारी, मुंह ढके, हाथ धोए, बनाए आपस में उचित दूरी, माँ बच्चे की सुरक्षा के लिए ये है जरूरी. Thank you, ma'am.
Very nice, Vijeta, and very nice way of presentation.
Thank you, ma'am.
What do you think is the role of the doctors in this?
Ma'am, I am working in a COVID dedicated hospital, Loknayak Hospital. So there we need to create awareness amongst the pregnant lady, like how to wear mask, how to wash hands while we are coughing or sneezing, how to place our hands and regular washing our hands, and as well as the emotional support. I have seen that patients in our facilities are really very emotionally deep down, like they don't know what to do because they are very isolated from their families and their relatives. So we are the only support, emotional support to them. So we will try to motivate them regarding their COVID pregnancy. So we play a very good role in that, in emotional as well as creating the awareness amongst themselves.
Thank you. So you mean to say a good counseling and a good emotional support is very important.
Vijeta, I just want to come in here.
Yes, ma'am, it is. Yes,
yeah, you have given a lot of advice, and as a role model, you have instructed how to go about, but nobody amongst the participants has focused on nutrition.
Yes, ma'am.
The importance of nutrition to improve your immunity so you can ward off infection.
Yes, ma'am. Because corona is like important. If our immune system is not that much effective, then the COVID risk is more. So we have to advise proper nutrition to the pregnant female. Like if they want to conceive, so we have to give them adequate nutrition advice regarding their conception and the pregnancy continuation, so that the effect of COVID will not overcome their immune system.
Dr. Vijeta,
Yes, ma'am.
I'm Dr. Kalpana. You are saying that immunity should be strong, and then the patient is going to get COVID. But in some patients who are having cytokine storm, it is their immune system which is bombarding their organs. Cytokine storm is what?
Yes, ma'am. Like
it's just immunity, so we cannot. So what,
ma'am? Like I want to say, better nutrition. Like immunity is like a different thing. Better nutrition will help a little bit. Yes, ma'am. Like if the patient is anemic, it will create more problem to her with respect to a patient who is not anemic. Like nutrition play in that way.
In that way, okay.
Yes, ma'am.
But it is not going to prevent COVID.
Ma'am, prevention is to prevention is by taking proper precaution. I think it will be help.
Yes. Okay. Very.
Move on to the contestants who are left
Yeah.
out.
Now we have two candidates, who were not able to join. One is Dr. Bhavani. Dr. Bhavani. Dr. Bhavani.
I think Mr. Sumit can share.
Ma'am, am I audible?
Yeah, you're audible.
Yeah, you are audible. Are you able to share?
Yes, ma'am. Is my
share your screen? Yeah.
Slogan visible?
Yeah, we can see.
Good evening to all the judges and delegates. My slogan is, we have bridled the wayward COVID ride. We obstetricians take every challenge in our stride. This slogan encapsulates the courage shown by the obstetricians in the face of this adversity. And what adds to their challenge is that at a time they are responsible for not one, but two lives. Thank you.
Excellent, Bhavani. I think Dr. Jyotsna had a question for you.
Okay, Bhavani, that was a very good presentation. What I would like to say is, in the line of duty, we come across, we face COVID day in and day out. So what is more challenging? Is it the providing your service to your patient, or protecting your family from getting COVID from you because you are a potential COVID positive?
Ma'am, I think there was a break in the connection, ma'am. Sorry, could you repeat
Okay.
the question?
Yeah, so in the line of duty, we do come across people who are positive day in and day out. So what is more challenging to an obstetrician? Is it providing your service to COVID positive patients, or is it protecting your family members from getting COVID from you? Because we ourselves are exposed and we are potential, COVID positive at any time.
Ma'am, both are equally challenging, because when we are in the line of duty, our main concern is our patient and nothing matters more than that. But when we go back home, the family takes priority, and at that time, there is definitely a grave concern regarding the health of our family. But in spite of that concern, being obstetricians, our main dharma, our first line of duty is our patients and providing good maternity care to them.
Very well
Dr.
answered.
Bhavani, can I ask a question?
Yeah, Dr. Geeta.
Yes, ma'am.
Dr. Bhavani, there is a question. Now, the obstetricians are ready to take every challenge. We have taken the Hippocratic oath. So we would rather die in the line of duty rather than anywhere else. Would you like the government to help you in this? And if yes, what ways you can suggest?
Definitely, ma'am. As we have been seeing that there have been so many deaths of COVID warriors while treating the COVID positive patients. And particularly the obstetricians are at very high risk because they have to spend long hours with the patients in labor, and there is a more likely chance of a breach in the PP for the obstetrician. So definitely the government should provide compensation in case, God forbid, the obstetrician loses their life in the line of duty. Because at the end of the day, it is we are facing a war.
Apart
And
from compensation, apart from the compensation aspect, any policy decisions? Any policy decisions?
Think out of the box, Bhavani. Any other government policy decision you would like? I think her signal has gone again.
Okay, Kanika, let's move on to the next one.
Man, Dr. Ankita Man, have you joined? Is she there, Man? The last one. Dr. Ankita Man, I can't see her.
No, ma'am.
No, she's the question, which is so she has given a written answer for it. The judges, please see the WhatsApp group. Consider to give her marks.
Can you read out, Niti, her answer?
She has made the guidelines for breastfeeding COVID. If the mother is well, she can newborn with a medical mask, taking all precautions and hand hygiene. If she is unwell, she can give express breast milk to the newborn.
Nice.
Okay. So thank you so much. Presentations by all the participants. So much creativity exists in AOGD. So now I request Dr. To deliver a vote of thanks.
I would just like to add that there were a lot of entries, and the top 20 were selected for 21 rather was selected for the oral presentation. So I congratulate all the participants, even if they were not selected for the final round, and whosoever wins. For us, I think all are winners, and everybody would get participation certificates plus ICOG credit points for the event. Thank you. Over to
Thank
Dr.
you, Dr. Kanika.
Thank you.
Is Ankita Man able to join, Niti? Dr. Ankita Man, is she able to join?
No, ma'am.
Can you give her a call? Because
We've
I
done
think
that. She's not available on the phone call.
Okay, fine. We should not leave any chance of allowing them, right.
So,
Dr. Mehta, you can.
yes, good afternoon, everyone. On behalf of organizing committee, it is my humble duty now to propose vote of thanks. My sincere thanks to Dr. Kanika Jain and Dr. Neeti Tiwari for conceptualizing the idea of slogan competition on a virtual platform and making it so interesting and informative. And a huge thanks to our esteemed judges, Dr. Geeta Mediratta, Dr. Angam Josna, and Dr. Kalpana Mehta for judging the session and for giving their valuable inputs and their valuable time. And we never thought of holding e-slogan competition on a virtual platform, but Dr. Kanika Jain and Dr. Neeti, you made it possible to happen. I congratulate all the participants of this e-slogan. You will all be getting a participation certificate on your mails, and winners shall be announced in the valedictory function on 1st November after compilation of scores by all the judges today. So with this, I come to an end of this session of e-slogan competition, and thanks to all the viewers, for this session. Thank you so much.
Thank you, Dr. Mamta.
Thank you, Neeti, Mamta, Kanika, Jyotsna. So such a pleasure to be here. And I would just like to say one last sentence before you wind up, that even though these virtual conferences was a headache, but I think it's a very good demonstration of the human ability, to adapt, evolve, innovate, You know,
We
and
can
even
come
on a
over
virtual
anything.
platform, even on a virtual platform, I feel we were all sitting next to each other, and you can access, very first-rate content. That is the lovely beauty of this.
Yeah,
Thank you,
it's a very
everybody. Had a
positive
great
start to
time.
the conference. Yeah, it's a very
Yeah,
positive
may I
start. We
add
are very
something?
hopeful.
May I
A
add
necessary mutation to the pandemic.
Yeah,
We have mutated.
something. It gives me a great pleasure to be a part of all these activities, because otherwise most of the time you tend to miss those activities. We used to have 2 days conference, and these activities were going on simultaneously in the third hall. So we used to miss all these PG activities because we used to be busy in the main halls. So now this pandemic has taught us so many things, that we can concentrate on the PG activities solely. And of course, when the days come, we can concentrate on the actual workshops as well as the main conference. So it's kudos to everyone, our organizing team who had been so great, working hard day and night to make all these PG activities a great success. Thanks to Dr. Mamta, Dr. Kanika, Dr. Neeti, as well as Dr. Geeta Mandiratta, and the judges, Dr. Josna, as well as Dr. Kalpana Mehta.
Thank you, ma'am.
The day, and thanks to all the participants, as well as the delegates who have been with us throughout this slogan competition. Thanks, everybody. Now we hope to see you tomorrow in the free paper competition. We all will be there throughout the day. Okay, bye-bye.